6:30 a.m. through noon. Hospitals everywhere really were inundated with patients during the pandemic, but tonight there is a sign of hope that things are slowly, we stress slowly, getting back to normal. Channel 3's Nicole Nalepa spoke to the assistant nurse manager at Hartford Hospital about what they've been through.
How are you and your colleagues doing in the emergency department right now?
We're doing well. It's been a challenging few weeks to months, but everyone has adapted really well. The staff has been incredibly resilient, and they amaze me every day. And so I'd say that we're coming through it really well, and we're prepared for whatever is still to come.
Now, there was an observation unit that was turned into a critical care unit in the emergency department. So is that still operational as an ICU?
It's not an ICU at this time. The needs have shifted now to general inpatient beds and observation beds. So it was a collaborative effort with many different specialties when we opened it as an ICU, and now it's shifted back to its intentional purpose when it was newly constructed as an observation unit. But we've been using it as what we call an ED overflow unit, so it can flex to what the needs of the hospital and our patients are and treat whatever type of patients need inpatient or observation care.
So surely that's a good sign then that it has been transitioned back, right?
Yes, absolutely.
Now, how has your job changed as a result of COVID-19?
I'd say in the ED we are always ready for anything that comes, but this has just been on a different level. I'm incredibly blessed to be part of such an amazing leadership team that is so innovative. We work so well together, and we're constantly planning for everything. So with the support of the hospital, we've created new spaces, changed those spaces, changed our processes. So it's just always been adaptability and camaraderie and what we always do, but on a different level. So I'd say that the teamwork is more important than ever, and the team has come through all this really well.
Certainly something I think you've probably learned through this experience, right?
Absolutely. And there's a lot that I've learned. It's a different type of patient care, having to connect with the patients in a different level because you're behind the PPE or their families aren't with them. Just learning the importance of wellness for our own staff to be able to care for other people, and just learning about how to manage a pandemic. There's so much that we've learned from this.